I've never felt professionally such a moment of joy.
Last November, the world rejoiced. The first vaccines for Covid-19 were ready. Could this be the beginning of the end of the pandemic? Well, not if you live in a poor country. Vaccines have started rolling out in the tens of millions in rich countries. But in low-income countries, it's not even hundreds. That's partly because most of the vaccines have already been bought by rich nations. Canada has enough to immunize each citizen 5 times.
We will now have 80 million doses of COVID-19 vaccines arriving this year.
So where does this leave the rest of the world? Well, many countries are going to miss out for some time. Millions of people will have to wait until at least 2022. Look at Latin America. It has a quarter of all coronavirus deaths. Doctors and nurses have been badly hit, but the rollout of the vaccine has been uneven and slow. And then you have places like Argentina, Venezuela and Bolivia that have approved Sputnik V, the vaccine developed by the Russian government, even though it hasn't completed clinical trials. Low-income countries are looking at COVAX for some of the vaccinations. It's a global initiative that wants to provide 2 billion doses for free. They'll start distributing them in February. But there aren't many vaccines left for COVAX to buy. It's the most unequal of races.
The world is on the brink of a catastrophic moral failure.
Guinea is the only low-income country to have delivered any shots to date. So some countries are having to find different strategies. Take India. It's got huge capacity to manufacture medications and vaccines. So it started supplying vaccines to other countries while immunizing its own people first. And then there's Indonesia. They're using a completely different approach, vaccinating younger people first because they're the most likely to get the virus and spread it. The African Union has struck a deal to secure 270 million vaccines. It sounds like a lot, but there are more than 1 billion people in Africa and they don't know when they're getting them. So is there a way to make vaccine rollout fairer? Well, if pharmaceutical companies told generic medicine manufacturers how they made it, everyone could produce more vaccines. But most of them have been reluctant to do it. They say they're giving them to low-income countries at reduced rates. With many countries not vaccinating until next year, the end of the pandemic feels a long way off.